highlight different events happening in our community. Of course, we always have you reach out to us if you have a charity event that's going to take place and you'd like to put a spotlight on it for whatever reason, or maybe it personally connects to us here on the show in our different lanes of our lives. In this case, it is Prostate Awareness Month for the month of September. That is one of the things being recognized this month. And for those that are newer to the show, you may not know that Ryan here on the show has battled prostate cancer not once, but twice.
This one's near and dear to my heart, and it's really strange. You remember when we did, when we were doing a Christmas wish in July?
Oh, yeah.
When we were doing it in the summer.
A few years back.
I got a phone call in the middle of recording one, and Rolla saw my face turn like ghastly white. And I was informed.
But we had to go professional.
We
just
did.
Keep on keeping on.
We continued, and we gave away that money to somebody. But during that break, I was informed that I had prostate cancer. So they recommended that I go to Houston Metro Urology. And that's where I met Dr. Van. And Dr. Van is with us in the studio right now.
Dr. John Van, welcome to the show.
Thanks for joining us.
Hey, good morning, guys. Thanks so much for having us here today.
And
Hope your patients aren't waiting for you, Dr. Van, because you're just sitting in here with us.
I think you just sit there and wait.
Because, I mean, he puts in a long day. Now, the reason I really I love this place is I've never had care like this with anybody else. I mean, Dr. Van, I have probably called you or texted you hundreds of times over the years. And he's always there and he quickly responds.
That's awesome that you respond, because sometimes doctors don't want to give out their
personal cell phones.
Yeah.
Information.
Yeah.
I'd say. That's real fun fast lane.
I've never met anybody.
They'll never leave you alone.
And it's not just me. You do this with all your patients. And I really think it's an amazing organization. And y'all are doing something really cool this Saturday. It's the Zero Prostate Run and Walk. Now, how many men will be affected with prostate cancer during the course of their life?
It's interesting because in the United States right now, it's estimated that 1 in every 8 men will develop prostate cancer at some point. So it is pretty common.
Is there a reason why? Like, is it our diet? Is it just
environment, genetics?
And is there an age?
Or do we even know that?
I think all of those things contribute. I mean, with regard to age, it is a condition that affects men later in life. The average age for newly diagnosed prostate cancer is around 65. With regard to why it's so prevalent, I think as we're living longer, we're going to be more susceptible to medical conditions that affect us as we get older. And then the detection for prostate cancer has just become so good that it allows men to be detected earlier, which translates into more men getting diagnosed. And then, of course, that translates into higher
That's true. It could always be here. It's just we never knew before.
Right. Because the thing that we learned when Ryan got diagnosed is that when you go, every single person who has some sort of a health care plan is supposed to have a physical once a year, but this is not something, or maybe now it's changed. Do they include the test for men?
PSA level?
So this PSA test that we learned from Ryan that you have to get, because I thought you have to ask for that, and they don't cover that in the general wellness exam.
It's interesting because right now for men age 50 and older, it is part of a general annual exam for the most part. I mean, I think that sometimes if men don't notice that the PSA is being checked, as long as they bring it up with their primary care physician, they'll almost always check it. It's pretty simple.
What's interesting is when I was in the waiting room, most of the guys in there were older, but it does occasionally hit younger people. My friend Gabe Canales, we've had him in studio
many times.
35 years old.
35.
35 he got diagnosed. Yeah. So it does happen at a younger age.
And really the point here is, to our Rule and Ryan show listening family, is that there are still so many men that just don't go to the doctor because they just don't go.
Put their head in the sand, or they think they don't want to do the
They don't want to do that exam.
The exam is so easy. It takes 2 seconds.
Yeah, so I think
you wouldn't want it to take any longer.
Men in general,
talk about the Astros while you're doing that.
And for the women that love them, a lot of men are very stubborn about going to the doctor. And your wife, your sister, your mother, your aunt could be pushing you all the time. Say, "Hey, have you been to the doctor lately?" Unless something is going on, people don't really necessarily go to the doctor. And then even when they see bad things happening, they keep it to themselves. They don't say anything, and then it's too late. So that's why we would try and put a little spotlight on this. It is Prostate Cancer Awareness Month. The Zero Prostate Run Walk is happening this weekend, Saturday, September the 7th. Where's the location?
It's at McGregor Park.
Nice.
And that's at 5225 Calhoun. 7:30 in the morning is when registration opens. 8:15 is the opening ceremony. I will be your MC for the event. The run walk's going to start immediately following the opening ceremony. Are you doing the walk run?
For me, it's gonna be more of a walk than a run. But yeah, I'll definitely be there.
Yeah,
I'll
I'm
definitely
not gonna be doing
there.
the run either. I'll be walking it.
Nobody's taking notes. It's
So
fine as long
if
as
you want to
join.
register online, you can go
Last
to-
place.
you can go to hmutx.com. That's hmutx.com.
And so maybe somebody's listening on behalf of the man in your life that you love. Even if the man in your life that you love might not be hearing us right now, you're hearing us. So push them in that direction. Go to the doctor, get your general well check exam, ask for the PSA test.
Yes.
Even what if you have like a 38-year-old husband and you're like, well, it said 50, so can you get that, or can you ask for that if you're 38 or 35?
You can, and definitely it falls into that category of no harm, no foul. It's such an easy test to get, and if you're a patient who has, for example, a family history of prostate cancer, it's even more a reason to get it when you're younger.
That's good to know. See,
Eric, you've actually been to Houston Metro Urology.
Yep, that's right. It's because I got my testosterone shots there, and believe me, it was very. I saved a lot of money there instead of just going every week to a different place. I went there, and they were so nice. They did all my checkups and stuff, and do blood work. That's when I got an email saying Ryan was going to be the host. I'm like, what? Why am I getting this email? I know him. I found out through an email, not through.
if you go to the website for the walk, you can register so you can participate in the walk. You can
But they
donate
take a walk
monetarily if
can
you
walk
can't be
up
there.
as well.
And so you go to, let me see, hold on. This website is, I don't want to give the wrong one. It says support.zerocancer.org.
I just went online at hmutx.com.
Okay.
You mentioned, Rolla, about if you got a man in your life. That's what's so interesting, because the second time you informed me that some cells had spread, some cancer cells, and gotten into the lymph nodes. I noticed every time I'd go into the lobby, you'd see a lot of wives nervously, very frightened looking, holding their husband's hand in the lobby waiting. And, I'd always walk up and try and talk to them and say, look, it's going to be okay. These people are amazing.
Who are you? Who's this guy? You just started talking to me.
But I think the reason I wanted to have you in here was to thank you, because you've talked me off the ledge so many times, and you talk to people in a way that's easy to understand.
What's
bogged down into technical stuff?
Right, what's it? PSA level B. And what does that mean? Because people listening, I'm just thinking we're saying PSA, but
PSA
people are
is
like,
public service announcement.
public service
not
announcement.
law.
Can you explain
What's it mean?
PSA means?
Yeah, so the PSA is really a laboratory test. It's drawn from the blood. The acronym stands for prostate-specific antigen. The history of PSA is really interesting because back in the 1970s and 1980s, prostate cancer was usually diagnosed later when it was giving rise to symptoms. In the 1990s, physicians began using this PSA test as a blood test and a screening tool to diagnose and find cancer of the prostate early. And like any other cancer or medical condition, the earlier it's diagnosed, the easier and more successful the treatment is. It's a blood test, and to answer the other question, regularly it should be less than 4. So if a PSA is checked and it's above 4, usually that's an indicator that either a biopsy or an MRI.
And Ryan, what was yours?
I can't remember what it was. It was considerably higher.
Was it like in
than
the teens
4.
or something?
That was an 18. You said 18.
Yeah. It had gotten pretty high.
I mean, that's gotta be
believe
scary.
It was. And, I remember the second time you used what was called a PET scan is how you found it. You actually found a little cancer cluster with a PET.
Yeah, and that's actually an interesting idea, too, because back when you were developing prostate cancer a second time, just as you had mentioned earlier, Ryan, it spread to the lymph node. And the lymph node in question was actually really tiny. On the MRI, it would have just been an afterthought because it was so small. But around that time, the FDA had approved the use of a new kind of PET scan specific for prostate cancer, and it allowed us to see that it was
So if this is just a few
effective.
years earlier, Could have
Maybe they
got
wouldn't
way
have-
worse.
Technology
Notice
changed
that.
between the first time I had it and the second time.
That was
So
only a few years.
technology is constantly changing.
And that's why donations are necessary, because that's what
You gotta raise
research
awareness and
finds
money.
in that.
That's why we're doing this.
If you're just tuning into the Rule and Ryan Show on 104.1 KRBE, we're talking to Dr. John Van. He treated Ryan for prostate cancer, and it's Prostate Cancer Awareness Month. There's a big run walk this weekend. There's also a survivor and caregiver recognition kids superhero dash for dad. There are all these different events. So y'all check it out.
Real quick, what would you say people to protect themselves from getting prostate cancer? Is there like just a better diet? Don't drink bourbon. Is there any other things? What would you recommend for people out there listening?
As you can imagine, the preventative measures that men can pursue for lowering risk of prostate cancer is similar to patterns or habits that they should consider for lowering the risk of any cancer. Basically, avoiding things that we know are probably bad for our health, whether
The
that's
fun stuff.
poor diet, excess in alcohol, excess in red meats, excess in sugars, avoiding other medical conditions that weaken our immune system, whether it's the development of things like diabetes or obesity. Anything that promotes health is inherently going to decrease our risk for developing cancers.
Okay.
Well, wanted to thank you for all that you've done, not just for me, but for everybody. And appreciate you coming in and telling us about this. We'll see you this Saturday. Once again, it's at McGregor Park. Please come on out. It's 5225 Calhoun. If you want to register online, go to the website is really easy. As I'm losing it right here.
Just go to zerocancer.org. Just go to zerocancer.org. Zerocancer.org. Just go
really
there.
easy.
Thanks, Dr. Van.
Thanks,
We'll let
guys.
get
That's
back
what
to
you
your
do.
patient.
Thank you.
And thanks for shining a light on this topic. It really does help our community. Thank you
That's
so
great.
much. Yeah.
Thank you so much.